Hello, my name is Chris Fry. Today we'll be sharing a video tutorial on how to perform ultrasound-guided injections of the hip and the shoulder joints in the dog. We have no conflicts of interest to disclose. Ultrasound-guided technique allows visualization of the joint space and confirmation of the needle path and location prior to injection. Visualization of the joints with ultrasound may help maximize synovial fluid feedback for diagnostic purposes while avoiding iatrogenic tissue damage to structures like articular cartilage, intra-articular ligaments, vasculature, or nerves. Visualization can also reduce the attempts to achieve placement within the joint, minimizing procedural time or further tissue damage. For the joints to be discussed, the dog should be sedated, placed in lateral recumbency, and an appropriately sized window clipped in the region to be imaged. The region should be aseptically prepared for injection and supplies gathered, including an empty 3 cc syringe. A 6 cc syringe may be used when needed to aspirate larger amounts of joint fluid. Additional supplies include the syringe or syringes containing the desired injectate and a 22 gauge needle. The ultrasound transducer may be sterilized with 70% isopropyl alcohol or sheathed in a sterile cover with gel medium between them. The length of the needle will depend on the size of the dog and the depth and position of the target. Most canine shoulders and hips require a 22 gauge needle of 2.5 inches in length for larger giant breeds and 1.5 inches for medium to small breeds. The amount of injectate will vary depending on the size of the dog and the joint to be injected, but may be up to 2 to 3 cc's in the shoulders of larger dogs if a combination of platelet-rich plasma and hyaluronic acid is used. Triamcinolone acetonide is commonly dosed at 0.2 mg/kg and split across up to 2 target joints being injected and may be paired with hyaluronic acid. For a shoulder joint injection, the spine of the scapula is identified, running lengthwise here, and the humerus running here. These bones create an angle that meets here. When we take our probe, it will be placed caudal to this angle, and the probe fanned cranially. Placing the probe caudal to this angle and fanning cranially, the caudal lateral shoulder joint is visualized. When the limb is rotated, you can see the humeral head rotate within the glenoid to confirm the location of the joint. Once the joint is located, rock the ultrasound probe back as much as the tissue will allow to optimize your approach. The needle is passed bevel up from the distal aspect of the transducer in alignment with the long axis of the probe and underneath the skin. Once the needle is first visualized by the probe, it may be redirected within the subcutaneous tissue before proceeding to ensure that correct trajectory toward the target over the humeral head and into the joint. The labrum is visualized at the edge of the glenoid and the needle directed below it to avoid iatrogenic damage to this structure. The transducer should remain in place during injection so that distension of the joint capsule and recesses may be visualized prior to removal of the needle. The dog's legs can be gently flexed and extended multiple times to further promote movement of the injectate within the joint space and dynamically visualize the injectate or capsular distension as seen here. The technique for hip joint injections was first described in a cadaveric study in a 2015 VRU article and is used at our institution consistently for canine hip injections. First, palpate the location of the hip joint by putting your thumb here, where you think the joint might be. Then rotate the limb and feel the greater trochanter. Next, palpate the wing of the ilium here. The ultrasound transducer is then placed midway along the body of the ilium and translated caudally until the hip joint space is visualized. You can confirm the location of the joint by rotating the femur and watching the femoral head move within the joint space. Within this image, you can see the greater trochanter, the femoral neck, and the femoral head all in one space, and watch the femoral head rotate in and out of the acetabulum. Once the hip joint is clearly in view, the transducer probe should be rocked back like this to optimize and expose the joint for needle approach. The needle is again passed bevel up from the distal aspect of the transducer in alignment with the long axis of the probe and under the skin. Once the needle is visualized by the probe, it may be redirected within the subcutaneous tissue before proceeding to ensure the correct angle to enter the joint space just below the visible hip labrum. As with the shoulder joint, once the needle tip is seen within the joint space, synovial fluid may be aspirated for diagnostics or confirmation of placement and followed by therapeutic injection. The transducer again remains in place during injection so that distension of the joint capsule and recess may be visualized prior to removal of the needle. Injectate in this dog can be appreciated as an anechoic fluid along the femoral head and expanding into the recess along the femoral neck, with the joint capsule immediately superficial to this region.